I became involved as an advocate for Fabry patients, myself included, in 2006 when I joined the board of the Canadian Fabry Association. There's two main reasons that I joined the board. The first is I like to get involved, and I get a sense of having some control over the disease and over how treatment access will be handled and over my own health by being involved. And the second reason is I had a conversation with Ed Koning. He was the first person I spoke to after I was diagnosed, and at the time he was the president of the Canadian Fabry Association, and I gained a lot of comfort from having a discussion with another Fabry patient, and I thought it would be good for me to return the favor and help other Fabry patients. The Canadian Fabry Association, or as we call it, the CFA, is the patient organization for people with Fabry disease, their families, and their caregivers in Canada. We have three main aims. The first aim is to provide patient support. So we hold patient meetings, provide an opportunity for patients and their families and their caregivers to come together in a social environment where they can exchange stories about their disease or about their lives. Our second main aim would be advocacy, where we want to ensure that patients continue to have access to the treatment for Fabry disease. And our third main aim is to try and improve the diagnosis of Fabry disease. Unfortunately, there are many patients that are diagnosed very, very slowly, and they may have many years of misdiagnosis. So we want to try and find ways to help improve their diagnosis so that they can get access to treatment sooner. One of the challenges with rare disorders is that the number of people are fairly small. The Canadian Fabry Association has approximately 300 members. So what we've done is we've joined the Canadian Organization for Rare Disorders, or CORD. And CORD's aim is to provide support for all Canadians with rare disorders. One of their main focuses is advocacy. First, to develop a regulatory framework for dealing with rare disorders, and second, to ultimately have an orphan drug policy. What we want to ensure is that all Canadians are treated equitably.